Danny says, how do you treat trauma? I'm a big fan of the prolonged exposure method. If you've had something very traumatic happen to you, you are probably going to spend a lot of time trying not to think about it. And as we said, once I tell you not to think of a pink elephant, you're probably going to think a pink elephant. So the best treatment that we have for trauma so far, the one that I've been trained in, and there's so much evidence for, is what we call prolonged exposure. And there's also cognitive processing therapy, those two. The thing that I love about prolonged exposure is it really takes the Mickey out of the trauma by telling someone, let's think of the trauma, right? Now, you might say, doesn't that re-traumatize people? Here's what re-traumatizes people: trying not to think of it and then reacting to it as if it's happening again. And what happens in a trauma reaction, we remember something and we have a fight, flight, or freeze response because our brain is convinced that the thing is happening again, even though it's really not, but we're convinced that it is happening again. So what do we want to do? We want to repeat the story of it over and over until the person is no longer bothered by it. They're even kind of bored by it. Exposure and response prevention therapy is available. We've got expertly trained therapists waiting to work with you. So please check us out at NOCD.com so that we can help.